Hello, this is Dr. Wells with Wells Medicine, and I wanted to talk about the questionnaires that we use at our clinic to assess patients, and questionnaires that are available to patients for home use as well. So when a patient comes into Wells Medicine as a new patient, one of the first questionnaires that we administer to pretty much all of our patients except for our pain patients or patients with chronic pain is something called the CTQ, which is the Childhood Trauma Quotient. And it is a very well-validated, long-researched questionnaire that looks at events in your childhood and gives you a score to kind of assess how traumatic your childhood was. So as evidenced by the Childhood Trauma Quotient, it's things like parental divorce, sexual abuse, malnutrition, parental abandonment, and there is some pretty good data showing that when you have a high CTQ, it often makes your treatment with typical medications like Prozac, Paxil, Wellbutrin, it makes attaining a good result with those treatments much more difficult. There does also seem to be really good data that a high childhood trauma quotient actually leans towards more success with a ketamine treatment or a stellate ganglion treatment. So it's not a bad thing in our clinic to have a high childhood trauma quotient. It can actually mean that the treatment might be more successful for you. We also do give the CTQ to our research partners at Baylor, fully anonymized, to help them with their research on ketamine treatments and childhood trauma. And we've published several studies and abstracts using that data. So that's given at the first visit, and it's never repeated. So the next questionnaire that we administer for our patients who are doing ketamine treatment or coming in for a depression treatment, we use a questionnaire called the Quick Inventory of Depressive Symptomatology. So QIDS is a very blunt scoring tool. It has about 16 questions, and it does ask, how have you been feeling over the last 7 days? Which, especially when you're coming in every few days for the initial 6 ketamine treatments, sometimes that can be a difficult question to answer because it hasn't been 7 days since your last ketamine treatment, and so your mood may be changing very quickly in there. It is a very blunt scoring tool. There are some questionnaires that I think better suit ketamine treatment, but this is the questionnaire that we sort of were grandfathered into with our research relationship with Baylor College of Medicine. And the reason that we have continued using it and the reason that it was chosen for us in the first place by our research partners is because it is such a well-studied, well-validated tool that has been used in many, many psychiatric intervention studies. There are a few others that have also been well-studied and also been well-researched, but they were much, much longer and more extensive. So the QIDS kind of fits the bill of being very well-researched and studied, but still, doesn't take a half hour to do every time before you're coming in for treatment. We provide the QIDS scores as well to Baylor College of Medicine for their work and research, all of this anonymized. Other questionnaires that we do when patients are coming in for nitrous oxide or for anxiety treatment with TMS, we'll use something called the GAD-7, which looks very specifically at anxiety. For stellate ganglion or for PTSD, we'll use the PCL screening tool. We're a little bit hampered in our data analysis because we only do the QIDS or the PCL or the GAD-7 on the day of the treatment. So, if a patient is coming in once a month, and we did the QIDS on the day of treatment, and then 3 days later, we might see some pretty dramatic changes. But we generally tend to only administer the questionnaires on the day of treatment. So we can miss a lot of the month when they're doing well and see the QIDS only when they're coming in for maintenance treatments and they're not feeling good, and their QIDS scores would be a lot higher. So we encourage patients to kind of track their moods at home as well. Often sort of subjectively, we are the last ones to know when something is going on with ourselves. Patients, families, or their circles around them often see changes, both positive and negative, before patients will often notice those changes in themselves. And sometimes what families will see positively, oh, you called Aunt Bertha, you went out to lunch, you wanted to go to Sephora, you cleaned your room, you washed your car, oh, you picked up a book, you picked up your guitar. So there's this sort of sense of movement. They'll also notice, oh, it seems like you slept better, you're eating a little bit better. And when patients start to notice the effects fading, what families or people around them will say is, gosh, you didn't want to go out with your friends last night. You seem so irritable. What's going on? You're so much flatter than you were. You're not doing as much. And so people around us can be very subjective about what's going on for us, but it's really great also to just have a score and sort of objectively follow our data. So we do that in the clinic, but there are some apps you can use to follow it at home. So all of the tests that I mentioned are readily available online. So you can download them, you can score them yourself. They all have published studies giving you the answer keys, the scoring metrics. So those are available for you if you really like a clinical study. They also have some apps where you just choose a smiley face or a frowny face, and it'll send you a little alert once or twice a day to kind of choose the smiley face or the frowny face, and you can trend it over time. There are some that just do a couple of questions, like the PHQ-9, which is a 9-question, just very quick set of questions. And there are some where they'll give you little prompts to say, how are you feeling today? How are you doing? And kind of trend that over time as well. Sometimes the objective measures, the QIDS or the GAD-7 or the Y-BOCS for OCD will show pretty good changes before patients are even noticing the benefit. So we had a situation the other day where someone felt like they really hadn't seen a lot of changes, but their QIDS had decreased dramatically over the course of their first 3 infusions. So sometimes those external changes can be a lot more noticeable later, where internal changes and changes on your scoring questionnaire that you're not even aware of can show that dramatic difference even before you're noticing. So I do encourage patients to kind of have an app or have a questionnaire or to really kind of query the people around you to make sure that you're getting some external feedback and subjective and objective feedback to watch your maintenance, know when to come back for more treatments, or to see how your treatments are kind of evolving over time.